Hello, I'm Dr. Margaret Ames, and you're listening to Your Dental Health. The purpose of the show is to get the word out about minimally invasive biomimetic dentistry. It's a major paradigm shift in dental care. And the other mission is for you to experience more comfortable and less invasive dentistry. If 20th century dentistry had been so great, there would be no such thing as redoing a crown. There would be no such thing as an implant or root canal therapy. This is my passion. You don't have to have amputational dentistry. Minimally invasive dentistry is here. In many cases, you can have decay removed by sandblasting it out without Novocaine. I'm passionate about this stuff. Call me. You can reach me in my office at 631-261-4525, and I invite you to look at my website, www.drames.com. I'm happy to have a guest that we're going to be talking to today, the author of the book Mouth Matters. But before I start to talk to Carol, I want to just give a big shout out to Invisalign. I do Invisalign. I have great results. The patients are always so happy. But a few shows ago, I talked about a woman from Belize who at 14 years old was in an electrical accident, and she had her left leg amputated and her right finger and has lots of scars. She's a strong 17-year-old now. She's wonderful. Her name is Damari. And I had her come up to visit because I want to see her on the motivational speaking circuit for young people. She has such faith and strength, you wouldn't believe it. But while she was here, I just said, let me take some records for Invisalign, because if you're going to be a professional speaker, I really want to get you looking great. So I took the records, took the impressions and the photographs and the x-rays, and I sent them to Invisalign. And I was so happy to hear this week that Invisalign has approved that they're going to donate the Invisalign service to her, and I'm going to donate my time to her. So Damari is going to have beautiful teeth. It's going to be great. So anyway, Carol, welcome.
Thank you. Thank you for having me. It's my passion as well.
Yeah. I have your book in my hands right now. I have quoted from your book during my show, Mouth Matters, Healthy Mouth, Healthy Body. Tell us a little bit about how you got involved with writing a book that's so conclusive. I mean, so intense, and it involves so much information.
Well, the first edition may not have been quite so intense. I, being a hygienist of 30 years, well, at the time maybe 20, 25, you can't help but see that gum disease is simply part of the network of inflammation in the body. And I just thought that there wasn't enough talk at the time about what has now become known as oral systemic medicine, how the health of the mouth affects the rest of the body and vice versa. So I just thought that somebody needed a handbook out there as far as that was concerned, because so many of my clients have diabetes or osteoporosis or heart disease and take their mouths or their oral health very casually. And I thought it was important for them to have a handbook for what could they do, how they're interconnected, so they could take it a little more seriously. And I guess it just started out of just being a little frustrated that more information wasn't available to the public. And I came to the point of realizing that hygienists are really just there to remove the evidence of disease, and that the mouth is a very easily accessible barometer to check for blood vessel wall integrity, mineral imbalances, microbe imbalances, nutritional status. It's just such an open book to read if a person knows how to read it. And it's been really fun. Mostly I was involved with gum disease and so on. It's a bit odd that I became interested in the health of teeth and so on. But at some point, I started to realize that perhaps failing teeth and what you replace teeth with could be a pretty strong influencer of what goes on in the body. So I was just thrilled to I met you at Tim Rainey's, I think several years ago, where we were learning about air abrasion dentistry, and the rest is history. It's just been fascinating.
Well, you and I have a not-so-secret dream of having it, the laws evolve, change to having hygienists to be trained in minimally invasive dentistry, because it doesn't require 4 years of dental school to learn this. And we could reach so many more people and be much more cost-effective. You went to Belize to observe this, didn't you, to do a dental mission?
Well, yes. Yes, it's so simple. It's so straightforward. I mean, I had done this many times in my head because I put together a chapter on minimally invasive dentistry. And even though I had worked with my daughter in that regard, I wanted to make sure that it was as easy and simple and straightforward as I thought it was. And it was even easier and actually a lot of fun to do. So we worked on hundreds of children. Most were dentists, but there were 2 hygienists there, and we took on clients just as the dentists did. And it's very straightforward, it's very simple, and it was wonderful not to have to even think about the idea of anesthetizing a tooth. You just begin, and they're very calm and they're very comfortable, and it's fast. And
no Novocaine, preserved tooth structure, minimal amputation. Yeah. I just want to tell the listening folks, if you've just tuned in, you're listening to Dr. Margaret Ames with Your Dental Health. My guest today is Carol Vander, author of Mouth Matters. It's a very comprehensive book about minimally invasive dentistry and the oral systemic connection. And Carol, you can tell the name of your website.
It's simple. It's mouthmattersbook.com.
And is there any place that you'd like to direct the listeners to learn more about the minimally invasive dentistry part of it?
I think probably the strongest thing to look at, I've temporarily posted a video that I worked last year on. It's called Avoiding the $6,100 Death Spiral. It's temporarily just right there on the home page, so just flip down to the bottom and click on it. And I couldn't think of even though I had maybe an hour-long interview with Dr. Mercola, I was wanting it to be more image intense, and so a video is the perfect way to do it. So if you want more information on, I think a lot of people don't understand how there are 3 ways teeth decay from the inside out. I think all of us, for the most part, including the dental profession, are only thinking about decaying from the outside in, fixing teeth from the outside in, when really you should know the 3 ways teeth decay from the inside out so that you can address those and know that healing can take place from the inside out. So that video can bring anybody up to speed, and anybody that has children out there, I heavily encourage them to watch that so they can seek doctors who can do what I call super sealants, to tell you the truth. One of the ways that it happens internally is those little pits and fissures in the grooves of teeth. It's impossible to diagnose with just simply x-rays and a pick. And have you talked about that on some of your other shows, Peg?
I have, but go ahead and elaborate. We've got a couple minutes before the break.
Okay. Well, it's just easy to go through those, especially with our new diagnostic tools that we have, like an Acteon or a Diagnodent, but to use air abrasion to kind of open up those pits a little bit, and then you can place a particular kind of material that isn't just bonded to the tooth like typical sealants. It really becomes almost a part of the tooth, and it can protect the sides of the teeth as well. And so some of these kids may never need any dentistry at all because they don't decay in between the teeth, they don't decay in the grooves. I think it's a really important adjunct that we should do. So
it's pretty amazing. I mean, dentists don't often embrace this right away, but once you learn how the decay between the teeth doesn't always come just from not flossing, but it can come from the pits and fissures on the surface of the tooth and the tooth trying to split. And it's not intuitive. But once you see it, you go, oh my gosh, look at that. Look at how that happened. The patient's flossing and there's no plaque there. How do they get this decay between the teeth? And then you magnify it and you can see the crack.
Yeah, the old-style dentistry, particularly when you use a drill and you have those sharp line angles and so on. I mean, yeah, cracks radiate from those easily, and so the cracks radiate outside, and every time you chew, you pump acids inside, and it's going to be a long time before you can pick that up on an X-ray. So by that time, a lot of the tooth is compromised.
Well, after the break, I want to hear about your daughter's lower right 12-year molar and the 3 ways the teeth decay from the inside out. So stay tuned, folks. You're listening to Dr. Margaret Ames with Your Dental Health. My guest this morning is Carol Vander, dental hygienist who authored the book Mouth Matters. You can reach me in my office at 631-261-4525. And my website, please look at that. A lot of informative videos is at www.drames.com. Stay tuned. We'll be back with you after the break.
There's something about you, baby, I don't know.